Hi, everybody. Thank you so much for coming to our talk today. We have the amazing Dr. Terika McCall. Dr. McCall is a National Library of Medicine Biomedical Informatics and Data Science postdoctoral fellow at Yale Center for Medical Informatics. Dr. McCall received her PhD at Health Informatics from University of North Carolina at Chapel Hill. Here at CHIP, we are very happy to have her. Her research focuses on reducing disparities in mental health services utilization through the use of technology. Dr. McCall's research is interdisciplinary and focuses on issues related to the acceptance, design, development, and use of mHealth applications for mental wellness. If you have any questions during Dr. McCall's talk, please feel free to add them into the chat. And then I do believe at the end of the talk, Terika, you'll be taking questions as well, right?
Correct, yes.
All right, great. Well, the floor is all yours.
All right. Well, thank you, Lindsay, and thank you everyone for joining this Zoom meeting. And so I'm going to just go ahead and jump right into it and present some of the findings from my dissertation. I'm actually going to turn off my video and just minimize it so it's out of the way and go ahead and begin. All right. So today I will present an overview of my dissertation research study titled mHealth for Mental Health, Culturally Tailored Interventions for Managing Anxiety and Depression in African American Women. I will briefly discuss the background and problem statement. Then I will present the methods and principal findings related to the research questions in Aim 1. Lastly, I will present the methods and principal findings related to the research questions in Aim 2, the conclusions, and the future directions. So let's start with a little background. Approximately 1 in 5 African American women experienced mental illness in the past year. The prevalence of mental illness among African American women is comparable to the general population. However, they use mental health services at less than half the rate of their white counterparts. Anxiety and depression are 2 of the most common mental illnesses. Approximately 16% of non-Hispanic Black women report having generalized anxiety in their lifetime, and approximately 27% reported experiencing depression in their lifetime. There have been numerous studies conducted on anxiety and depression among African American women. However, few focused on using telehealth modalities to deliver interventions for treatment. It has been shown that the application of technology for healthcare often takes longer to reach traditionally underserved populations, and past literature on e-health and mHealth studies mostly focused on physical health interventions for African Americans, as opposed to mental health interventions. Although there is a scarcity of published research on the use of mobile technology for management of anxiety and depression in African American adults, African American women are more likely to participate in mHealth research than their male counterparts. So the challenge is there is a significant unmet need and underutilization of mental health services among African American women. Furthermore, barriers such as stigma of mental illness and less access to treatment prevent African American women from seeking care. So I ask, how do we make mental health services and resources more accessible to this population? I believe the ideal solution will incorporate technology they already have access to and require minimal education on its use. So the first aim of the study was to gauge the attitudes and perceptions of African American women towards utilizing mental health services and determine the acceptability of using mobile technology to help them manage anxiety and depression. There are 4 questions under this aim. The first question was, what are the attitudes and perceptions of African American women toward using mental health services? What are the barriers to utilization of mental health services? Is the use of mobile technology acceptable to African American women in terms of delivering mental health services and resources and helping them manage anxiety and depression? And which modalities are more acceptable than others, specifically looking at mobile app, video call, voice call, and text messaging, and the use of that to deliver mental health services and resources. So what I did for AIM-1, I used the mixed methods approach, incorporating both quantitative and qualitative methods. A web-based survey was launched and focus groups were conducted in order to answer the research questions. With the survey, it was launched in October 2019 and closed in January 2020. And women 18 years or older who identify as Black, African American, or multiracial, Black, African American, and another race, and reside within the United States, regardless of their mental health history, were eligible to participate. Participants were recruited through convenient sampling. Recruitment methods also included receiving an invitation to take the survey via an anonymous link distributed through listservs whose membership is primarily African American women, such as the National Council of Negro Women, and university student group listservs and church membership listservs. Participants were also recruited via posts on social media, such as Facebook and Twitter, and following a snowball sampling technique, respondents were allowed to share the link to the survey with their networks. So the survey domains included questions about participants' attitudes toward seeking professional psychological help, the acceptability of using a mobile phone to receive mental health care, and screening for the presence and severity of anxiety and depression. Now, I just want to define a few terms in the subscale to measure participants' attitudes towards seeking professional psychological help. Psychological openness is the extent to which individuals are open to acknowledging psychological problems and to the possibility of seeking professional help for them. Help-seeking propensity is the extent to which individuals believe they are willing and able to seek professional psychological help. And indifference to stigma is the extent to which individuals are concerned about what various important others might think should they find out that the individual were seeking professional help for psychological problems. So for the survey, I used the following methods. I used quantitative methods where I used descriptive statistics and calculated it to better characterize the study participants. I also used Fisher's exact test to determine whether an association exists between age or education and comfortability with using voice call, video call, mobile app, or text messaging, respectively, to communicate with a professional to receive help for managing anxiety or depression. In addition, independent group t-tests were performed separately to assess group differences and mean scores for depression and anxiety, and depression and anxiety severity, psychological openness, help-seeking propensity, and indifference to anxiety and depression stigma, respectively. And this is basically looking at the difference between the groups of participants who agreed with the use of the various telehealth modalities to communicate with a professional and those who disagreed with the use. I also used thematic analysis. I conducted it on the responses to the questions about concerns with using the modalities to receive mental health treatment or counseling. Now for the focus group methods, I held sessions at Durham County Library and at the University of North Carolina at Chapel Hill in January of 2020. And once again, the women, they just had to be 18 years or older and identify as Black, African American, or multiracial and reside within the United States. And it was regardless of their mental health history, they could participate regardless of if they had a diagnosis or not. And they were recruited via the aforementioned survey. So at the end of the survey, it routed them to an additional mini survey where they could put in information if they wanted to be entered into a raffle, and also if they wanted to be contacted about the focus groups. So I did recruitment through the survey, and then also posts on social media and flyers posted on community boards at local coffee shops, county libraries, churches, and colleges and university campuses in Durham and Chapel Hill areas. So I moderated the focus groups and had a note taker present, and the topics of discussion included past and current causes of anxiety and depression and coping skills used, attitudes and perceptions towards mental illness and receiving mental health treatment, barriers and facilitators to the use of smartphone app for mental health care, and what content is needed in a smartphone app designed to help African American women manage anxiety and depression. So for the focus groups, I used a pragmatic qualitative research approach, and I basically used it to present a comprehensive summary of events in everyday terms for responses to questions that describe personal experiences or opinions. And then I also used thematic analysis with the responses to questions about preferences or concerns. So now I'll dive into the results by first discussing the characteristics of the survey and focus group participants. So for the survey, 395 respondents completed the survey. The respondents' mean age was 44.8 years old, and all identified as Black, African American, or multiracial. Most respondents identified as non-Hispanic, and furthermore, 79% had obtained a bachelor's degree or higher. Annual household income was reported at less than $50,000 for 40.3% of the sample. For those who made an income of $50,000 to $100,000, that was about 35% of the sample. And more than, for those that made more than $100,000, that was around 24% of the sample. Approximately 94% indicated that they did have health insurance. And so as we look at mobile phone use among the survey respondents, 99% of the respondents indicated that they had a mobile phone. And approximately 98% used text messaging, and around 73% indicated texting 4 or more times per day. The majority of respondents also indicated that they use mobile apps, and around 73% indicated using a mobile app 4 or more times per day. Most respondents also indicated that their phone had video call capability, and approximately 80% reported use of video call, with about 38% indicating using it at least once a week. So now for the focus groups, we had 20 people participate in the focus groups, and there were 4 focus groups with 5 participants each, and the participants range in age from 21 to 79 years old, with a mean age of 36.6, and all once again identified as either Black, African American, or multiracial. So the first research question under AIM 1 was, what are the attitudes and perceptions of African American women towards using mental health services? The study findings show that African American women have favorable views towards seeking mental health services. In the survey, respondents were asked to gauge their psychological openness, help-seeking propensity, and indifference to stigma. And the higher scores indicated more positive attitudes towards seeking professional psychological help, with a range of 0 to 32. And as you can see, the mean score for psychological openness was 23.5, and for help-seeking propensity, it was about 25.9. The indifference to stigma questions were adapted to collect data on indifference to anxiety stigma and depression stigma, respectively. And the mean score for indifference to anxiety stigma was approximately 25.3, and the mean score for depression was 24.5. So you can see that the attitudes were predominantly positive. They were positive. The focus group results were supportive of this. Most of the focus group participants endorsed using mental health services, such as seeing a therapist. However, they stressed the importance of having a therapist that looks like them. For example, one participant stated, "I think it's excellent if you could find somebody. I personally feel like they have to look like me and know where I'm from. So I'm in for seeing a therapist." The second research question under AIM 1 was, what are the barriers to utilization of mental health services? And the barriers identified by the survey and focus group participants included costs, not knowing where to get services, stigma, lack of time, concern that they might be committed to a psychiatric hospital or might have to take medicine, and difficulty finding a preferred provider. And also they had some concerns about confidentiality. So as you can see from this table, 3 of the top 5 reasons that survey respondents did not seek mental health treatment when needed basically was associated with cost. And again, the focus group results were supportive. Focus group participants also identified cost, lack of time, lack of transportation, and stigma as barriers to treatment. Regarding stigma, one participant stated, I think a lot of people who go to therapy, not a lot of people know that they're in therapy because it's like, oh, well, if they know that I'm seeing somebody, then what are they going to think about me? I think a lot of people would love to use those resources, but they fear the judgment that's going to come behind that with seeking therapy. So moving on to my third and fourth research questions. The third research question under aim 1 was, is the use of mobile technology acceptable to African-American women in terms of delivering mental health services and resources and helping them manage anxiety and depression? And the answer is, it depends on the modality that is used and on age. The last research question is, which modalities are more acceptable than others to use in the delivery of mental health services and resources, And the findings from the study revealed that they are most comfortable with the use of voice call or video call to communicate with a professional to receive help to manage anxiety and depression, as opposed to text messaging or mobile apps. So just diving a little bit more into the stats, approximately 73% of the survey respondents indicated agreement, which means they either selected agree or somewhat agree as a survey response regarding the use of voice call to communicate with a professional to receive help to manage anxiety. Furthermore, 66.1% of respondents agreed with the use of a video call, approximately 48% agreed with the use of a mobile app, and 46.3% of respondents agreed with the use of text messaging. Similarly, approximately 70% of respondents indicated agreement with the use of a voice call to communicate with a professional to receive help to manage depression. 64.3% of respondents agreed with the use of video call, approximately 45% agreed with the use of a mobile app, and 45.1% of respondents agreed with the use of text messaging. And once again, agreement is, the way agreement is lumped is whether they agreed or somewhat agreed. So when I looked at acceptability by age group, the results of the study showed that younger African-American women, those that are less than 50 years old, were significantly more likely to endorse use of text messaging, mobile app, and video call to communicate with a professional to receive help to manage anxiety than older African-American women. Furthermore, younger women were more likely to endorse use of all the modalities to communicate with a professional to receive help for managing depression. When I looked at acceptability of mobile phone use by education, there was no statistically significant association found between education level, looking at those that had less than a bachelor's versus those that had a bachelor's degree or higher, and agreement with the use of text messaging, voice call, mobile app, or video call to communicate with a professional to receive help for managing anxiety. Likewise, no statistically significant associations were found between education level and agreement with the use of voice call, mobile app, or video call to communicate with a professional to receive help for managing depression. However, one significant finding emerged in regards to education level. Respondents who reported less than a bachelor's degree were more likely to endorse use of text messaging to communicate with a professional to receive help for managing depression than respondents with a bachelor's degree or higher. And this finding may largely be due to age, since undergraduates are primarily between the ages of 18 and 24, which is the adult age group that uses text message the most. So moving on to the second aim of my study, and the second aim is actually two-part. The first part was to design and develop a user-centered prototype that presents important content and preferred features for a smartphone application to help African American women manage anxiety and depression. The second part was to test and evaluate a user-centered prototype of a smartphone app tailored to help African American women manage anxiety and depression. So there's one research question under this aim, and it's what user-centered recommendations should be addressed in a smartphone application designed to help African American women manage anxiety and depression. So again, I used a mixed methods approach, incorporating both quantitative and qualitative methods. I used focus group and also usability testing of the mobile app. And I basically used this to address the questions under AIM 2. So in February and March of 2020, individual usability sessions were held for each participant in the University of North Carolina School of Nursing's Biobehavioral Lab. And so women age 18 or older who identified as Black, African American, or multiracial, and they were allowed to participate. They were eligible to participate regardless of their mental health history. Participants were also recruited via posts on social media and a recruitment listing on Research for Me at UNC. I also posted flyers on community boards at local coffee shops, community libraries, churches, and on college campuses. So in order to do the usability testing, the cognitive walkthrough method was used to evaluate the user interface design on how well it supported users in learning to complete the tasks. Specifically, this method was used to evaluate the ease in which users can perform a task with little or no formal instruction or informal coaching. Participants were read a persona and scenario and then asked to begin the 4 tasks. And they were also told to speak aloud their thoughts and actions so that it could be recorded by the Tobii eye tracking software. And I'll speak a little bit about this in the next slide, but I basically split the sample so that roughly half of the sample did the first scenario task, and then the other half did the second. And I also want to mention that the questionnaire for user interface satisfaction was self-administered after the usability testing was complete to collect data on system performance and the most positive and most negative aspects of the app. So in order to limit participant burden, when testing most of the features of the app, there were 2 different personas and scenarios with 4 tasks each. And so you can see here scenario 1 and task and scenario 2. So one focused more on anxiety and the other on depression, but there was a little bit overlap, and both required them to locate a therapist to schedule an appointment. And I just wanted to mention that participants did not enter any personal information into the app. The instructions for each task included dummy information for the participants to enter to complete the task. So for my quantitative data analysis, descriptive statistics were calculated to better characterize the study participants. In order to measure efficiency, mean, standard deviation, and range were calculated for time to complete each task, the number of taps required to complete each task, and also the number of taps required to complete each task. To measure user interface satisfaction, mean, standard deviations, and ranges for scores in each of the quiz domains was calculated. Also, Tobii eye tracking software was used to create heat maps to reveal the focus of visual attention on the screens. So a little bit about the characteristics of the participants. 15 participants participated in the usability testing using the cognitive walkthrough think aloud method. The participants ranged in age from 20 to 66 years old, with the mean age being around 30 years old, and all identified as either Black, African American, or multiracial. Furthermore, about 87% obtained a bachelor's degree or higher, and the majority of participants indicated that they use mobile apps 4 or more times per day, and about 7% use mobile apps 1 or 3 times per day. So the research question under AIM 2, as I discussed, is basically what are the user-centered recommendations that should be addressed in a smartphone app designed to help African American women manage anxiety and depression. And the recommendations focused on the type of content and features that should be included in the app, as well as suggestions to increase app usage and to establish trust with the users. As far as recommendations on content such as information on how to find a Black woman therapist and guidance on how to deal with common stressors were given by focus group participants. Features such as mood tracking and group chat rooms to connect with others were also recommended. The participants also gave suggestions to increase app usage, and it included the ability to connect with a preferred therapist through the app and the ability to learn coping techniques. In order to establish trust with users, it was recommended to be transparent about who created and who owns the app and how user data is protected. So many of the recommendations from the focus group were included in the initial prototype used for usability testing. And so what you're seeing is the home screen of the app that was tested. So the app actually contained the following primary features. It had a guided thought journal, information about anxiety and depression, including facts about the prevalence of anxiety and depression among African American women. It had self-assessments for depression using questions from the patient health questionnaire, the PHQ-9. And also self-assessment for anxiety using questions from the Generalized Anxiety Disorder Scale, the GAD-7. It had a mood rating, graphs to track trends in depression and anxiety severity, and mood rating history, and also resources like links to Therapy for Black Girls Therapist Directory. It had podcasts in there and also a self-care planner. Additional recommendations from the focus groups will be included in the next version of the app. So these were just the base features that were tested during usability testing. So I'm going to talk a little bit about the results from the quiz. So overall, the results of the usability testing showed that participants were mostly satisfied with the user interface of the app. For the first scenario and task, and I broke it out because they completed different tasks for scenario 1 and 2. So for the first scenario and task, the average mean score for each domain ranged from 7.2 to 8.3 on a scale from 0, which is low satisfaction, to 9, high satisfaction. The average mean for overall reactions to the software was 7.2. Presentation of information on the screen was 7.3. Terminology used and app information had a score of 7.6. The ease of learning to use the app was rated at 8.0, and the app capabilities had the highest score of 8.3. For the second scenario task, the average mean score for each domain ranged from 7.5 to 8.8. So that one was actually a little bit higher. And once again, the scale is 0 being the lowest to 9 the highest satisfaction. And the average mean score for overall reactions to the software was 7.5. The presentation of information on the screen had a score of 8.0. Terminology used and app information had a score of 8.4. The ease of learning to use the app was rated at 8.2, which is pretty good. And then app capabilities at 8.8 out of 9. So some of the insights gleaned from the cognitive walkthrough and the heat map of screens were that the app should be intuitive and easy to use. Important information should be placed on the left side or middle of the screen, and that the interface should be visually appealing with clear labeling. So what you're seeing here is a heat map of the managing anxiety tip screen. And you notice that you see the more intense red coloration to the left and middle of the screen. Furthermore, with the recommendations, basically found that the app should also include helpful features that allow them to monitor their mental health. Example, having depression severity monitoring. These are things that they brought up within the usability testing, that they wanted to learn coping skills. So it was kind of confirmatory. It's confirming what people said in the focus groups. They're saying, yes, we would like these things within the app. Also, they wanted to be able to connect with needed resources and to plan activities for self-care. So I want to talk a little bit about the strengths and limitations of the study. So the main strengths of the cross-sectional survey were that the large sample size and the wide age distribution. And the main strengths of the focus group was also the sample size. So the focus group, we had 4 focus groups with 5 participants each. And so results from a study by Guest and colleagues revealed that more than 80% of all themes are discoverable within 2 to 3 focus group, and 90% of themes could be discovered within 3 to 6 focus groups. So having 4 was an ideal number. And the main strengths, moving on to the usability study, was that the design and the use of the cognitive walkthrough think aloud method, as well as eye tracking glasses and software, and administration of the quiz actually helped us to fully capture data on the usability of this app. So as far as limitation in regards to the survey, the main limitation was the mode used to administer the survey and the recruitment methods. So due to the sensitive nature of the questions and for convenience, the survey was only available online. And although this method may increase privacy and reduce respondent burden in completing the survey, women who do not have access to email or social media account may not be able to complete the survey by accessing the link. In regards to recruitment, participants were recruited through convenience sampling and encouraged to share the survey email or social media posts with their networks. And although no PII was collected in the survey, and respondents accessed the survey through an anonymous link, social desirability bias could have resulted if the respondent personally knew me. In addition, the sample consists of mostly highly educated women. So about 79% had at least a bachelor's degree, and most of them had health insurance, about 94%. So this limits my ability to broadly generalize the findings to all African-American women. However, previous literature showed that African-American women with health insurance are still less likely to use mental health services compared to their white counterparts. A limitation for the focus groups now was that most of the participants were under 50 years old. So the sample skewed towards capturing the thoughts and opinions of younger African-American women. So this may limit the generalizability of the findings to older African-American women. And also, given the stigma of mental illness in the African-American community, participants may have felt peer pressure to give socially desirable answers to the moderator's questions. One of the main limitations of the usability testing is that due to the geographical restriction in recruiting participants, the results may not reflect the opinions and perceptions of a nationally representative sample. Also, most of the participants were under 50 years old, so that sample, so the sample basically skewed towards capturing thoughts and opinions, once again, of younger African-American women. In addition, personal preferences may also be revealed in the feedback, which may not actually be helpful in improving the usability of the app. Another limitation was that this study did not focus on efficacy of the app to reduce anxiety and depression, as this would require a randomized controlled trial and significant resources to be done properly. However, despite these limitations, the proposed study design yielded useful data that would help researchers to understand the mental health needs of African-American women and provide a framework for designing a smartphone app to help this population to manage anxiety and depression. So in conclusion, most African-American women own a smartphone. It's about 80%. Therefore, there's a great opportunity to use mobile technology to provide mental health resources and services. Mobile technology can be used to eliminate or mitigate many of the barriers identified by the study participants, such as having a lack of time, not knowing where to receive mental health services, and difficulty finding a preferred provider. However, a one-size-fits-all approach to designing mHealth interventions to help African-American women manage anxiety and depression should not be used, as it may lead to more options but continued disparity in receiving mental health care. So a user-centered design and testing should always be employed in order to truly address the needs of the population and to increase the efficiency and effectiveness of the mHealth intervention. So as far as future directions, I just want to point out the obvious, like currently the world is being affected by the coronavirus pandemic, and people are grieving the loss of their loved ones, canceled plans, and their loss of normalcy. And in the midst of this, we are facing a national crisis due to police brutality against African Americans and anxiety over the upcoming election. This is also negatively affecting our mental health. So mental illness is the invisible pandemic that's occurring due to high anxiety, depression, and isolation on top of this visible pandemic, of the coronavirus, right? So this is, I feel like it's being talked about more now in the media, mental health and mental wellness. So telemedicine, including telemental health services, the use is on the rise now due to this. So personally, I intend to explore the effect of the current events on the mental health of African American adults and their use of telemental health services. My hope is that despite all of the tragedy, there be an increased awareness of telemental health services. So these are my selected references and my acknowledgements. And so I'll go ahead and open the floor for questions now.